Over the last decades, the number of medical schools around the world has increased remarkably, and many have been established under questionable conditions. Accreditation, or the establishment of standards for medical and nursing education, is widely accepted as an essential condition for the quality of the education.
So, I'm going to give my patient.
The accreditation of our institution means that our institution is authorized to train and is recognized. We admit students from other countries like Uganda, Rwanda, Zambia, Ethiopia, and so on. That is why accreditation is so important to us.
The purpose of accreditation and quality improvement in medical and nursing education is to gear up for the changing conditions in the healthcare delivery system. With accreditation, doctors and nurses are better prepared for the needs and expectations of the society.
The practice of nurses and midwives is regulated by the Nursing Council of Kenya. And this starts right from the training, from recruitment really. The Nursing Council sets up the syllabus and the training institutions develop the curricula. It also regulates the practice.
Many doctors and nurses from developing countries migrate internationally, and this situation is unlikely to change in the near future.
The general consensus is that probably about 50-55% of our graduates do go abroad, and the remaining half, most of them end up staying in the city areas rather than go to serve in the rural areas.
Economically, things became better for me when I came to America, United States of America. And that was the reason why I migrated. I am grateful that I was trained in Guyana. I didn't pay a penny for my training in Guyana. I had 4 years of training and 4 years of quality training that I am very proud of.
Nursing practitioners and facilities must demonstrate to accrediting bodies that they possess the personnel, resources, training, experience, and regulatory understanding to provide quality nursing treatment to patients.
Yes, I know that my school is accredited by the fact that we are allowed to train. Nurses who have trained here have also gotten licensed and they've been able to be employed. And it is being accredited by Nursing Council, which is an arm of Ministry of Health, which is tasked with giving approval to institutions who want to give nursing education.
To help countries and policymakers in doing so, the World Health Organization recommends 1. Working towards an international sanctioned system for accreditation of health worker programs. 2. Maintaining support for regions to proceed with current regional accreditation initiatives in support of global standards. 3. Work towards including healthcare worker training in higher education institutions. Accreditation of health professional education should be introduced where it does not exist and strengthened when needed. Quality of evidence, low. Strength of the recommendation, strong. We recommend these options. Key considerations. Accreditation must be based on standards. It must be supported by legislation. It should be done independently. The process should be transparent. The system and process should be periodically evaluated.